Call the roll, please.
Senator Beasley, Senator Bell, Senator Butler, Senator Chastain, Senator Coleman Madison, Senator Gavan, Senator Roberts, Senator Shelnut, Senator Stewart, Senator Weaver, Senator Williams, Senator Stutz, Senator Melson.
Here. All right, we have a quorum. We're going to start with Representative Rigsby's bill, HB 77.
Are we on? All right. Good afternoon. Thank you, Mr. Chairman. Thank you, members of the committee. This is HB 77. A little backstory about this is I met a dynamic young man last year at a breakfast who has a rare genetic disorder. And this bill carries his namesake, is Mr. Zach Thomas. He's in with us today in the room. And this is the Zachary Thomas Newborn Screening Act. What this piece of legislation does is it was worked on between the Alabama Department of Public Health and a group called Alabama Rare, and it will expand the newborn screening panel where we currently are testing for 33 rare genetic diseases, and it increases that to the national recommended screening panel of 37, including MPS 1, Pompe, MPS 2, and GAMT. It will also lessen the timeline of adding new tests as they're added to the recommended uniform screening panel from 5 years to 3. And it does allow for the Department of Public to postpone that if they're having issues with funding due to funding for equipment or labor force issues without being able to get the people to do those tests. We hope that that's not the case, but we did want to give them the opportunity to have that if they needed it. But I'll be welcome to answer any questions about this if you have any.
Well, before we do that, let's meet Zach.
Zach, where are you, buddy? There he is.
You know, that's, and I heard what you said about funding and being able to put it on hold, but we really need to have some way not to allow that to happen. Because early intervention, a lot of these diseases and the treatment's crucial. So we don't really need to be delaying testing and things like that when there's something out there to make their life more manageable and have a better outcome. So that's just something, I appreciate that. But
Yep.
Any questions for the sponsor?
Mr. Chairman.
Yes, sir. Senator Roberts.
Representative Rigsby, thank you for bringing this bill. I sit on the Rare Disease Council of Alabama, and we deal with this on a regular basis. This is all still from a heel stick, am I correct?
That's correct. It's a newborn heel stick. That's what most patients are used to. That is the baby's going to have a heel stick, and that's what this is testing is for.
And colleagues, if you've not seen, we have a new lab in Prattville that is doing this, and it is remarkable what they're doing. And it's worth going by sometime and see it as you're heading north or south from here. So thank you for bringing this bill, and I wholly support this. Thank you for the work.
Thank you, Senator.
Senator Betts?
Thank you, Mr. Chairman. I certainly support the newborn screening. Think we ought to screen for all of these things. But my question is, why is it necessary to have legislative action to add 3 or 4 or 5 more? I mean, to me, this seems like exactly what the Department of Public Health ought to be doing, is keeping up with these guidelines, adding things when they needed to be added, and do it in a expeditious fashion. And 3 years, 5 years, 36-month limit, it ought to be as soon as you can get it done. It shouldn't be, and that's what they ought to be doing, and it shouldn't really even be a legislative issue, in my opinion.
Well, I agree with you. That's probably would be ideal. I think in this case, though, this was necessary to help kind of push that along to make sure we get up to the recommended, at least national recommended panel of screening. And so I don't know what has held that up to this point. I can't answer that question, but I think this is just to kind of help spur that movement along so we get there.
Yeah. Is there anybody here from Public Health that can address that? I'm curious to know what the holdup is and why we need to take action for you to do your job.
Good morning, Senators, or good afternoon, Senators. Thank you for allowing me to come up and address this. I don't think that there was a holdup except for COVID. And so as we went through COVID and as we had limited staff and were overwhelmed with COVID tests, we are keeping up with the implementation of the RUSP. I think you will see in the next 10 to 12 years many more RUSP-approved tests going on. So Rare Disease approached us and wanted to put a time limit on this. We were fine with that. As you know, with staffing, we have to have microbiologists, lab technicians, and lab bench people. And with state government, what we're doing a lot of is training people in these positions, and then private entities are taking them away from us. There are about 35 steps that you have to go through on every test, which includes testing 60,000 babies. When a new test is implemented, it requires new machines, it requires training, and I'm delighted to get you the 30 steps that are involved with this, but it does take at least 2 to 3 years to get these up and running. And so we were happy to work with the representative and the rare disease folks to just address this for the future when we see more of these tests that are going to be available.
All right. Senator Bell?
I guess following up on your question, so you're saying the reason new tests were not added was financial, staffing, and COVID? I guess.
New tests are being adopted the entire time. I think when COVID hit, obviously, a lot of people were focused on COVID during the pandemic. But we are continually adding new tests. Other states put time limits on their tests, and so we're just getting in line with what other states have done in legislation. It's not that we're not adding tests all the time, but this was something done nationally, and the rare disease folks approached me from the national level and wanted a similar situation. And so that's why we put this bill together and put the time limit on the bill.
So without legislation,
We would still, I understand what you're asking. I think this is just, sometimes we do legislation because we're looking at future tests, and we don't know how many tests could be hitting us through the RUSP process. And so I think this is just something for the future to make sure that we're implementing as quickly as possible. Does that make sense? I'm sorry. Does that answer your question?
Well, I guess we need to just get a cleanup bill that says you will implement it every year, upgrade it as every year, and look at it. And
Well, and I mean, I think it takes 2 to 3 years to do, and that's why we had the 2 to 3 year. It takes longer than a year to implement a test. Between getting the machinery, working with the geneticists on training on the machinery, testing with the 60,000 samples, testing the machinery. So there is a long process to implementing these tests, the primary tests.
so you're telling me by the time they upgrade the list, it will take 2 to 3 years to?
It does. It does.
Okay, we need to look at that probably, but
Yeah, no, and I'm happy to share all the steps with you and share that with the committee.
okay. Any, Senator Second. Senator Roberts. All right, call the roll, please. Are any more questions before we? Okay, call the roll, please.
Senator Beasley? Senator Bell? Senator Butler? Senator Chastain? Senator Coleman Madison? Senator Gavan? Senator Roberts? Senator Shellnut? Senator Stewart? Senator Weaver? Senator Williams? Senator Stutz? Senator Melson?
Aye. 12 ayes, 0 nay. The bill is given a favorable report.
Thank you, Mr.
Rick.
Chairman. Thank you, members, and congratulations, Zach.
All right, next bill.
HB 69 by Representative McCampbell.
And he's not here, but this bill is just a controlled substance prescription database access that, Mr. Ingram, would you like to come up and talk about?
Absolutely. Thank you, Mr. Chairman, members of the committee. Reagan Ingram for the Alabama Board of Dental Examiners. This just adds one paragraph to the state controlled substances law to give dentists the same authority that physicians have to have 2 employees access the database to make sure that a drug that's being prescribed is appropriate or not being abused.
Mr. Chairman, I move.
Senator Stutz.
I move favorable report.
Second, Ms. Weaver. Any questions? It's pretty much, okay.
Thank you.
Previous row? No objections? Okay. Next bill.
HB 70 by Representative McCampbell.
All right. I'll just let you go ahead.
Representative McCampbell had this fabulous idea. This is his idea. There's an employer has a large health care fair for its employees in West Alabama in his district on the border. And what they had was they were trying to do a dental fair, but there was not a local dentist available, but there were dentists from Mississippi that didn't have licenses. So he said, can you get a volunteer
Alabama
license?
license.
An Alabama license. They had a Mississippi license, not an Alabama license. You know, some guy with a pair of pliers and a and a bottle of whiskey. No, it was a Mississippi dentist in good standing wanted to come over and help with the fair but couldn't. And he said, can we do something to remedy that? And the board worked with him and they came up with this special volunteer license where they will be able to do two times in a year, get this special license to be able to practice 15 days on a volunteer basis in the state of Alabama. And it can work for any border counties or any event, you know, it could be here in Montgomery.
But there's a background check to make sure they're in good standings with.
They have to be in good
Mississippi.
standing with their current state. An Alabama dentist does have to participate and be the custodian of the records. So we want to make sure that the care is provided, but also provide access, particularly in our border states that may have underserved areas.
Any questions for the surrogate sponsor?
Move for approval.
All right.
I move for approval. I think it's a great idea because
Coleman
who knows, it may cause some
Second.
of these dentists in these other areas to move to Alabama and establish root. They see there's a market.
All right. Do we have any objection to using previous row? Okay. 12 to nothing. Bill's given a favorable report.
Mr. Chairman, if I'm going to have it that easy, can I market my services to this committee as handling bills?
Please.
Thank y'all very much.
All right. Call the next bill.
SB 37 by Senator Allen.
Mr. Chairman, committee, thank you. Under current law, the Alabama Clean Indoor Act prohibits smoking in public places, most public places. This piece is very simple. It's adding something to the current code to prohibit the smoking of the electronic nicotine delivery system. If you look at page 3 on line 71, look at page 3 on line 71. This is the only thing adding to the current code there. And And that's the genesis of this, and why I brought this is that I was at a grandson's football game this past fall in Bibb County, and sitting in the stands, and young fellow sitting next to me vaping, and I said, wait a minute, we got to maybe address this. But anyway, so that's the genesis of it. Mr. Chairman, any questions?
Okay. Senator Chastain, second. Senator Roberts, any objection to previous row? No objection. Well, bill's given a favorable report.
Thank you, sir. Thank you, committee. Thank you.
SB 200 by Senator Kitchens.
Mr. Chairman, members of the committee, thank y'all for letting me bring this bill before you today. This bill deals with the Board of Nursing. Currently, there are 2 appointments to the Board of Nursing that comes from the advanced practice of nurses. This would just codify that a nurse anesthetist is one of those. Would be happy to answer any questions y'all may have.
Any questions for the sponsor? Favorable by Mr. Oh, you got a question?
I do.
All right. Senator Stutz.
Thank you, Mr. Chairman. Senator Kitchens, as I read through it, I mean, some of the terminology is confusing. The LPN and LPN, and it means 2 different things.
Yeah, the first is licensed professional nurses, which is
I
considered an
understand
RN.
that from the bill, but I've never heard that term used in a hospital of the LPN. Most people in the hospital say it stands for low-paid nurse, but but then as distinguished from an RN, and then to use it twice in the bill, I mean, I don't know, that may be common terminology at some level, but that I've worked in a hospital for 31 years and I've never heard that terminology. So, anyway, I'm thinking while we're doing something, if that's not commonly accepted terminology, Senator Weaver, you may have a different opinion. You've worked in administration and stuff, but
the nurse practitioners that are on the board, the advanced practice nurses, I mean, to me, we could clean up the terminology a little bit if the Board of Nursing was okay with that.
I didn't see one.
There was one section.
I'm not sure. Is anybody here from the Board of Nursing? All right. Step up and give us your name, please.
Hi, I'm Alice Henley. I'm the General Counsel for the State Nursing Board. You had a question. Could you tell me which part of the bill you were referring to on the licensed professional?
Where you're referring to LPNs, licensed practical nurses and licensed professional nurses, and then the advanced practice nurses were a subset under the licensed professional nurse.
Right. So licensed professional nurse is a term that's actually in various parts of the Nurse Practice Act, and that is one of the technical titles, but those are registered nurses. So that is, they're called RNs, and if you look later on in the bill, it specifically says so many are RNs and so many are LPNs. So to change it in this bill, you would really need to change it throughout the statute. But that term is used throughout the Nurse Practice Act, licensed professional nurse. And I do know that's kind of confusing because it's LPNs is what everybody calls it, licensed practical nurse. But they are professional nurses because they're considered at the professional level.
So that would be nurse practitioners, RNs, whatever.
Nurse practitioners and RNs, any advanced practice nurse and a registered nurse.
Or a licensed practical nurse, or would all fall under that same category?
Professional nurse would not include an LPN. An LPN is a separate title. The only ones that are referred to in the statute as professional nurse are the registered nurses. That's just how the statute is written.
So same initials, different meanings.
Well, I don't know that they use the initials here because we would never refer, at least I've been there 16 years, we've never referred to a professional nurse as an LPN. We always call them registered nurses, which is the protected title. So the protected title in the statute is RN, registered nurse, and licensed practice nurse, practical nurse, LPN.
I guess, so professional nurse, practical nurse, we just need to realize those aren't the same.
Yes, sir. That's basically it. It's just been in the statute the entire time that way. So
Okay.
those are the two sets of licensed nurses, and then you have 4 types of advanced practice nurses: CRNPs, CRNAs, CNMs, and clinical nurse specialists.
Mr.
Okay.
Chairman.
Any questions and more questions?
I've got one.
Just a comment, I guess, a question.
Go ahead. Senator Coleman Madison.
As I understand the bill, basically, we're just basically adding 2 members to represent, as you said, certified nurse anesthetists.
No, ma'am. What the bill does 2 things. First, the current statute already provides that 2 of the appointments are for advanced practice nurses. This bill requires that one of them be a CRNA, which historically it always has been, and it also changes which organization submits the nominees to the governor. In other words, currently they're all submitted by the State Nurses Association. This would change the CRNA appointment to originate out of the Anesthesiology CRNA Association.
So what you're doing is you've always given them a seat at the table. They're wanting a reservation there now.
Yes, yes, sir. And this bill did not originate out of the board, but, certainly we don't oppose it. We would actually prefer to have the opportunity to bring a more comprehensive approach to handling how those appointments are generated, but we certainly don't oppose this.
All right. Senator Shelnut.
Chairman, my only major concern is I see my commissioner, Joe Knight, in the audience, and I'm wondering why he's here. How are you doing, Commissioner Knight? No, I'm in favor of this bill, and I'd like to renew the motion to move for favorable if there's no other questions.
Senator Shelnut, second by Coleman Madison. Do any more questions? Okay.
Mr. Chairman,
Senator Roberts.
I too saw Commissioner Joe Knight walk in, and is there anything you need to enlighten us on this bill, sir?
Thank you. I'm Joe Knight. I'm the General Counsel for the Alabama Association of Nurse Anesthetists, as well as County Commissioner in Jefferson County, and thank you for the call out there. I've been General Counsel for about 25 years with the Alabama Association of Nurse Anesthetists, and years ago we had that agreement. There would be 2 advanced practice nurses on the Board of Nursing, and one of them was always to be a CRNA. And that was before the present administration at the Board of Nursing. That was before 2 previous directors of the Alabama State Nurses Association. So before everybody kind of forget that agreement that we had years and years ago, we were just wanting to go ahead and solidify this and codify an agreement that was been implemented years ago and is still in place, but we just wanted to get it in writing in case those of us who helped put this together years ago or move on and are forgotten. So that's and it's sort of like the nominating process has been kind of a convoluted process over the years. And I know Ms. Alice said that they're wanting to revamp it, but that's the first we've heard of it after we kind of got this bill out there. But we're just simply wanting to codify something that has been in place, in agreement for many years. It's not any kind of practice rights. This is just, and I think it's similar to one of the Senate Bill 228, I believe it is, where y'all are thinking about reforming the health board and letting your specific doctor groups have their own nomination. That's simply all this is. Let the nurse anesthetists.
Mr. Knight,
Yes, sir.
You're going to talk yourself out of a bill.
No, sir.
Yeah, why don't we just go ahead and get a favorable report and move on?
I would very much appreciate that. I'll
Thank
be
you,
quiet.
Mr.
Thank you very much.
Commissioner. We appreciate it.
All right, all in favor of previous row? Any opposed? All right, bill's given a favorable report.
Thank you, Mr. Chairman, members of the committee.
Thank you.
SB 128 by Senator Melson.
Thank you. We got two bills today, Senator Gavan and myself, dealing with the same issue. We're getting closer to common ground. I'd like to move both these out. We'll get together in the following week and try and find a solution. I think both of them have pros and both of them probably need a little work. I think you'd agree with that, Senator Gavan. So under my bill, and then I'll let him talk to his, this deals with the State Board of Health and the State Committee of Public Health. It will actually eliminate the State Board of Health because they meet once a year and do nothing except get together and have a conference. And they don't make any major decisions for the state public health, at least none that I could find out. So the State Board of Health would be eliminated. And that their duties, what few they do, would be removed over to the Committee of Public Health. The membership would remove the massive appointments down to 4, only 4. They currently have, I believe, 10, and then, or maybe 11. And this would take it down to 4. Then the 6 other physician members would be appointed by their specialties. So if OBGYN and others would appoint their, whoever they feel like would represent the public's interest in their own specialty. And then the governor and the commissioner of ags would also appoint somebody. I know the governor wanting to appoint has been one thing that, have an appointment has been one thing that people have wanted. Then also, they still will retain the ability to appoint the public health officer, but at any time, the lieutenant governor, the pro tem, and the Speaker of the House can call the committee in and discuss the behavior or the decisions being made. And they could determine if it'd be like having a hospital executive committee reviewing a physician's action. It'd be a peer review instead of political reviews like I'd like to think of it. Make sure the medical decisions are made what's best in the interest of patients. And at that time, they can determine if the actions were appropriate or inappropriate, and if they're inappropriate, what action would they recommend. Corrective measure may include anything from termination to just saying, hey, you need to consider that and run that by us if need be, a second opinion. It also keeps it where they could, again, have the governor can approve or deny certain actions proposed by the state health officer, which is one of the issues. Currently, the governor's been doing that as well. I think the last COVID situation has been an example where the governor listened but didn't always follow the health officer's recommendation. Everybody thinks that the health officer, I shouldn't say everybody, but the public in general thinks the health officer made the calls, but that was run by the COVID committee and the cabinet at different meetings, and then the governor would make the decision on what actions to follow and what not to follow. But that would retain the ability for the health officer to make the decisions, and then the governor could override them, which is pretty much the way it is now. And then it makes just some other technical changes, but I'll be glad to answer any questions or concerns about it. But it just keeps it more peer review. I think if we have, I know that my colleague has had some concerns about the governor being able to terminate the health officer, which I understand that, but I think it makes it more political. It'd be like a hospital administrator getting between the patient and the doctor, or a workman's comp claim and the caseworker makes decisions instead of the doctor, or a insurance company in general saying you need to go get a second opinion when you can tell that the person needs whatever procedure done. So I just think it keeps a layer of politics out and keeps the patient more the direct concern instead of job security with a health officer. Anyway, Senator Chastain. Well, thank you. Second, Senator Gavan. Senator Butler.
Mr. Chairman, is it your intent to essentially merge these two bills?
Well, I think it.
Use one as a vehicle, whatever?
I think so. You're not going to vote on two bills. We'll find a compromise. I think either amendments from one or the other will make it where it's palatable and we'll have accountability, which
Yeah.
I think is, well, yeah.
Could I get you to brief the whole committee before you go to the floor?
Sure.
Oh, good. Good.
Yeah.
That's all.
All right. Thank you. It will be the next one coming up. Yes, I think we have been in some ways. In some ways, we just need to finalize it. But I think there's good points in both. And I hear a second by Senator Gavan. Okay. Any objection to previous row? All right. The bill is given a favorable report, and Senator Gavan.
Thank you, Mr. Chairman. So this is the State Health Officer Bill, SB 74, that would allow the governor to appoint the state health officer. I won't go through all the history of that. A lot of that's been laid out when we passed this last year. Well, I guess a modified version of that, and we ended up changing it on the floor, never ended up passing as we got late in the calendar. So I think that, this is about accountability. This is about the Department of Public Health having accountability to the people through elected officials. I think there is a way we can get there that Senator Melton and I have been talking about, using one of these bills as a vehicle. Doesn't really matter which one, as long as we get we get something that's good for the public. So I'll answer any questions if there are any. If not,
So if the governor is going to be responsible for appointing the public health officer, is this going to be vetted again by not politics making the decision or who heads that department? Because we understand, going back with COVID, what happened, but that you do have that layer of professionals that are looking at public health as a whole, not necessarily the economics, but the well-being of the public. So what check and balance do we have there on the governor's side, who is an elected person?
so that's part of what we're going to end up doing. And in fact, we had in the bill last year, but would be, this is what I envision happening. Let me say that, is that we would get into a situation that if we get more accountability with the way this board is appointed, then I think that I can be comfortable with that board giving 3 names to the governor and going from that perspective. And that would be your check and balance.
So is it both of you all's intent that, I heard you say you want to get both bills out.
Yes, today, and then we'll merge it. There'll only be one come to the floor, though.
Okay, but I'm hoping that if y'all getting both bills out, so we're gonna come with one bill. Is that one bill gonna come back to this committee prior to going
We'll
to
get
the floor?
we'll get a copy to every committee member. What it'll probably entail is one bill getting a meeting, but there'll be amendments that will be taken on the floor. So we're not going to pass a bill out of here that you won't see on the floor. There'll be amendment or substituted. Fair statement?
I don't know. I just want to make sure that because public health impacts everybody, across the economic spectrum and everything. And I just want to make sure that whatever comes out, that we all understand what comes out, because again, you're dealing with all your county health departments and everything else. So this is a huge issue. And I don't want to take it lightly.
I can assure you it's not being. All right, favorable by Senator Bell, second by Senator Butler. Previous row, okay? All right. All right. 11. All right, Bill's given a favorable report. Thank you very much. We're dismissed.